Hey there, YouTube fam. Welcome back to our channel. Today, we have an incredibly important topic to discuss, the rising rate of colorectal cancer among younger people. It's a topic that demands our attention, and we want to shed light on the significance of early detection. Colorectal cancer has long been considered a disease that predominantly affects older individuals. However, in recent years, there has been a disturbing trend, an alarming increase in the number of younger people being diagnosed with this type of cancer. Yes, you heard that right. Young adults, even those in their 20s and 30s, are facing the daunting reality of colorectal cancer. It's a wake-up call that challenges our preconceived notions about who is at risk. In this video, we want to explore this rising phenomenon, understand the possible factors contributing to it, and emphasize the critical importance of early detection. Colorectal cancer, when caught in its early stages, is highly treatable. That's why awareness and education are crucial. By the end of this video, we hope to empower you with knowledge, motivate you to take charge of your well-being, and emphasize the vital role each of us plays in spreading awareness about colorectal cancer in young people. So, if you're ready to delve into this crucial topic and learn why early detection can save lives, then keep watching. Don't forget to hit that subscribe button and ring the notification bell, so you never miss an important update from our channel. Host, alright, let's get started. Recent studies have shown that colorectal cancer is becoming more common in younger people and at more advanced stages. According to the American Cancer Society, ACS, 1 in 5 cancer diagnoses occur among patients under the age of 55. 3 out of every 5 patients had advanced disease. These altering patterns emphasize the value of early identification and screening as life-saving strategies. Doctors acknowledge rise in instances among youth. According to data from the American Cancer Society, colon cancer is the third most prevalent disease diagnosed in both men and women in the United States. It is anticipated that 106,970 new instances of colon cancer and 46,050 new cases of rectal cancer will both be diagnosed this year alone. According to Dr. Kyle S. Eldridge, a general and colorectal surgeon in Wellington, Florida, the prevalence of colorectal cancer in adults over 50 has been declining over the past 3 decades as a result of greater screening. However, for people younger than 50, the incidence has been increasing by 1 to 2% per year since the 1990s. According to predictions, colorectal cancer will account for the majority of cancer-related fatalities in adults between the ages of 20 and 49 by 2030. According to Dr. Eldridge, the gut microbiota, nutrition, and lifestyle are all likely to have a role in this rise among younger people. Recognize the danger signs. Age is the highest risk factor for colorectal cancer, according to Dr. Eldridge, even though diagnoses have tended to be made in younger patients recently. Over 90% of cases are discovered in those over 45. The greatest risk factor for colorectal cancer is age. Family history is another important risk factor. Having a single first-degree relative with colorectal cancer can increase your risk 2 or 3-fold, he said. Other risk factors include smoking, obesity, and alcohol use. Inherited diseases such as ulcerative colitis and Crohn's disease can contribute to higher polyp formation. Identify the cautionary indicators. According to Dr. Eldridge, many persons with early-stage colorectal cancer experience no symptoms, but it's crucial to be aware of the symptoms. Changes in bowel habits, stomach discomfort, bloody stools, weakness, and exhaustion are a few of these symptoms, along with rectal bleeding, anemia brought on by blood loss, and unexplained weight loss. Obey screening recommendations. Screening is the most effective way to prevent colorectal cancer from developing, stated Dr. Eldridge. Non-cancerous polyps are the precursor to early-stage cancer. A 75% to 85% reduction in the risk of colorectal cancer can be achieved via screening and excision of these polyps. For individuals at moderate risk, the ACS advises that screening begin around age 45. According to the ACS, individuals are deemed to be at average risk if they have no personal or family history of colorectal cancer, no history of inflammatory bowel disease, no confirmed or suspected hereditary colorectal cancer syndrome, and no radiation therapy to the abdomen or pelvis for prior cancer. The greatest strategy to reduce the risk of colorectal cancer is by early screening. The best screening technique, according to Dr. Eldridge, is a colonoscopy, which employs a camera to see the colon directly. Any discovered polyps can be removed. The ACS suggests that individuals with average risk levels get a colonoscopy every 10 years. Dr. Eldridge advises increasing the frequency to every 5 years for those at higher risk who have a family history of colorectal cancer or polyps. The CT, computed topography, colonography is an additional visual screening test that creates three-dimensional pictures of the colon and rectum using a computer. Stool-based investigations are another option. They require more regular execution but are less intrusive. Dr. Eldridge declared, even if each test has benefits, the best test is the one that gets done. And that's a wrap for today's video. We hope you found this discussion on the rising rate of colorectal cancer among younger people and the importance of early detection informative and eye-opening. Remember, no one is invincible when it comes to cancer, regardless of age. It's crucial to prioritize our health, be aware of the signs and symptoms, and take proactive measures to stay ahead of this disease.